You know that feeling when you really want to understand something important, but without getting totally bogged down in technical stuff?
Yeah, wading through jargon.
Exactly. Well, that's what we try to do here. Today, we're taking a deep dive into something that might hit close to home for many of you with pets. Exocrine Pancreatic Insufficiency, EPI for short, in dogs and cats.
Right. We've sifted through some pretty detailed medical sources.
To pull out the essentials for you.
Think of it as like the fast track to grasping EPI. Basically, it's when the pancreas, super important for digestion, right, isn't making enough of the enzymes needed to break down food.
Like a key worker not showing up for their shift.
Exactly.
Yeah.
And the
Oh,
whole
yeah.
process just falters. This obviously leads to trouble with digesting food and absorbing all those vital nutrients.
Okay, EPI, exocrine pancreatic insufficiency. Let's break that down a bit more. The pancreas has these specific cells, acinar cells.
That's right, acinar cells. They're the little factories making the digestive enzymes. In EPI, there's a problem either not enough of these cells or they just aren't producing what's needed.
And why does that happen? What causes this shortage?
Well, usually it boils down to one of two main things.
Yeah.
The most frequent cause is the actual destruction of these acinar cells.
Like the factory itself gets damaged.
Pretty much. This often happens because of chronic pancreatitis long-term inflammation. That accounts for, well, maybe half the dog cases and nearly all the cat cases.
Interesting. Almost all cat cases.
Okay.
And the second cause.
The other big one is something called idiopathic pancreatic acinar atrophy, PAA.
Idiopathic meaning we don't really know the exact cause.
You got it. And atrophy just means the cells are withering away, shrinking.
Oh.
Now, this PAA is particularly common in German Shepherd dogs.
Ah, okay. So if you have a German Shepherd, this is definitely something to have on your radar.
Absolutely. It's a major factor for the breed. Early recognition is key.
We'll definitely come back to the German Shepherd link. So enzymes aren't working. Food isn't broken down. What are the consequences? It must affect their nutrition badly.
Oh, absolutely. No enzymes means maldigestion food isn't properly processed in the small intestine. And that leads directly to malabsorption. The body can't pull the nutrients out of that undigested food.
So maldigestion is the breakdown failure. Malabsorption is the uptake failure.
Exactly. Two sides of the same EPI coin. And you see the results? Weight loss, even if the poor animal is eating normally or sometimes even more than usual.
Eating loads but losing weight.
Yes. And then there are the stools, often loose, bulky, sometimes greasy looking. That's called steatorrhea.
Steatorrhea, right, like oily.
Kind of, yeah. Plus, you often get an upset in the gut bacteria balance, that small intestinal dysbiosis. The bottom line, the pet can end up with serious protein-calorie malnutrition.
Really impacts their whole system then. Okay, so who gets this? Well, we know dogs and cats.
Both, yes. But it does seem to be less common overall in cats. For dogs, though, as we mentioned, there's that strong breed link. German Shepherds are way up there because of PAA.
So common it's almost expected, you might say.
Well, it's certainly something every German Shepherd owner and vet should consider if the signs fit. Rough-coated collies and Eurasians also see PAA more often.
But other breeds aren't immune.
No, definitely not. Other breeds can absolutely get EPI, usually linked to that chronic pancreatitis cause we talked about.
Is there a typical age this pops up?
For the PAA in German Shepherds, it tends to hit young adult dogs. Think 1 to 4 years old, usually.
Relatively young then.
Yeah. But EPI caused by chronic pancreatitis, that can really happen at any age, in both dogs and cats.
You mentioned a hereditary angle with German Shepherds. Is it genetic?
The strong suspicion, the assumption really, is yes, PAA in German Shepherds is hereditary. It seems to be a complex trait, though. Maybe Otto's is all recessive, but it's not fully pinned down. It's likely more complicated than a simple gene thing.
Which makes breeding decisions tricky, I imagine.
Yeah, definitely. It's something responsible breeders need to be aware of.
Okay, let's talk signs. If you have a German Shepherd, especially a young adult one, what are the absolute red flags for EPI?
Vigilance is key. The big combination is weight loss, often significant weight loss happening alongside chronic loose stools or diarrhea.
Even if their appetite is fine.
Yes, often despite a normal or even ravenous appetite. The severity can depend on how quickly it's caught and treated.
What else might an owner notice day to day?
Well, those stools, again, they're often described as looking like cow patties. Large volume, pale, loose, sometimes greasy. It might be constant or it might come and go.
Intermittent?
Yeah. And gas, Lots of flatulence and stomach rumbling, borborygmus is the technical term that's especially common in dogs.
Noisy tummy.
Very. And sometimes, due to not getting enough nutrients, they might start eating weird things,
Hmm.
like their own poop, that's coprophagia, or other non-food items, which is pica.
Desperate for nutrients, I suppose.
Likely, yes. And one more thing, if the EPI stems from chronic pancreatitis that also damages the insulin-producing cells, you might see signs of diabetes developing. So increased drinking and urination.
Polyuria, polydipsia. Got it. And what would a vet pick up on during an exam?
Physically, they'd likely find the animal is thin, maybe even emaciated, with poor muscle mass. Their coat might look dull or poor quality. In cats, though it's less common, you might see greasy fur around their back end from the Steatorrhea.
Okay, so we've covered the what, the who, the signs. Let's recap the why. The direct causes are.
Primarily, it's that pancreatic acinar atrophy, PAA, especially in those predisposed breeds. Then there's chronic pancreatitis damaging the cells. And much more rarely, a pancreatic tumor, an adenocarcinoma, could block the duct.
And risk factors beyond breed.
Really, anything that predisposes an animal to getting chronic pancreatitis in the first place would increase their risk of eventually developing EPI.
Makes sense. So the vet suspects EPI. How do they confirm it? What's the diagnostic path?
First step is usually ruling out other things, like detective work, Eliminate other suspects.
What kind of suspects?
Things like liver problems, kidney failure, certain hormone issues, or even primary gut diseases like IBD. They can all cause similar signs like weight loss and diarrhea.
Okay. What about initial blood tests, like a CBC or chemistry panel?
Interestingly, those basic tests are often completely normal in EPI cases.
Really? That seems counterintuitive.
It does, but remember, the main problem is enzyme production, which doesn't always throw off the general blood markers. So you need something more specific.
Which brings us to the key test.
Exactly. The gold standard, the test of choice, is the Trypsin-Like Immunoreactivity test, TLI. It's a blood test. We call it CTLI for dogs, FTLI for cats.
TLI. And what does that actually measure?
It measures trypsinogen and trypsin substances that are released only by those pancreatic acinar cells. So it's a direct indicator of how much functional pancreatic tissue is there.
Like counting the active workers in the factory.
Perfect analogy. In healthy pets, the levels are normal. In EPI pets, the levels are drastically low because those cells are gone or not working.
Are there specific numbers?
Yes, the cutoffs are pretty clear. For dogs, a CTLI of 2.5 micrograms per liter or lower, says EPI. For cats, an FTLI under 8.0 micrograms per liter points strongly to EPI. It's simple, quick, sensitive, and specific, really the go-to test.
Okay, so TLI is the main diagnostic tool. Are there other ways people use to check pancreatic function?
Yeah, there were tests looking at enzyme activity in feces, like fecal proteolytic activity or fecal elastase. But honestly, they're not very reliable. Lots of false positives, false negatives.
So stick with the TLI.
Definitely, unless maybe you're dealing with an exotic species where a TLI test isn't available. Things like just looking at stool under a microscope for undigested fat or plasma turbidity tests, they're just not recommended anymore. Not reliable enough.
Got it. Now, you also mentioned checking cobalamin and folate levels alongside the TLI. Why is that important?
Super important point. Cobalamin is vitamin B12. Folate is another B vitamin. We check them because, well, cobalamin deficiency is incredibly common with EPI.
How common?
Something like 80% of dogs with EPI, and basically all cats with EPI, are low on cobalamin.
Wow, okay.
And if you don't correct that deficiency, the pet might not respond well to the enzyme treatment. So checking these levels tells us about potential B12 deficiency and also gives clues about whether there's that bacterial imbalance dysbiosis or maybe even underlying intestinal disease contributing to poor absorption.
So it helps fine-tune the treatment plan.
Precisely. Addresses the whole picture.
What about imaging? X-rays, ultrasound? Do they show EPI?
Not usually, no.
Yeah.
Abdominal imaging typically looks unremarkable for EPI itself. It's more useful for checking for other things like signs of chronic pancreatitis or maybe ruling out a tumor, that kind of thing.
Okay. And if you could look at the pancreas tissue itself under a microscope, what would confirm EPI?
Depends on the cause. If it's chronic pancreatitis, you'd see depletion in those acinar cells, maybe some fibrosis or scarring, inflammation. The factory looks damaged. If it's PAA, you see profound atrophy. The acinar tissue is severely shrunken or almost completely absent.
Wow.
Factory's just vanished.
Very clear distinction there. All right, diagnosis confirmed. What's next? How do we manage this? What's the treatment strategy?
Usually it's outpatient medical management, meaning treatment at home.
No hospital stay needed, typically?
Not unless there's a complication, like if the pet also has diabetes from the pancreatitis, then they might need a short hospital stay initially to get their blood sugar under control with insulin.
Okay. And diet. Is there a special EPI diet?
It's less about a specific brand or type of food and more about getting those missing enzymes into the pet. That's the absolute cornerstone, pancreatic enzyme replacement therapy.
So the enzymes are the critical part, not necessarily a specific food formula.
Mostly, yes, although you do want to avoid diets that are really low in fat or super high in fiber.
Why is that?
They can actually make digestion and nutrient absorption more difficult, even with the enzyme supplements. So moderate digestible diets are generally best.
And you stressed cobalamin supplementation earlier.
Cannot stress it enough. Given how common deficiency is, again, 80% of dogs, nearly all cats supplementing cobalamin is crucial for most EPI patients.
How is that given? Pills?
Usually it's given by injection. Subcutaneous, under the skin. There's a standard dosing schedule to get their levels back up and then maintain them. It really makes a difference in how well they respond overall. Sometimes severely malnourished dogs might also need vitamin E to call for them.
What about other vitamins?
Other fat-soluble vitamins, A, D, K. Usually supplementation isn't critical unless there's a specific deficiency identified, which is less common than the B12 issue.
Okay. What are the key messages for owners when their pet gets an EPI diagnosis? What do they need to understand long-term?
Education is so important. If it's a German Shepherd, discussing the hereditary possibility is key. Owners need to grasp that enzyme therapy is almost always lifelong.
Lifelong. Okay. And potentially costly.
Yes, the enzyme supplements can be a significant ongoing expense, so that needs to be discussed up front. Also, if it's pancreatitis-related EPI, they need to be aware that diabetes could develop later. Forewarned is forearmed.
Any role for surgery in EPI?
Extremely rare. There was one report from Finland about a specific complication, mesenteric torsion, sometimes seen in German Shepherds with EPI, but generally surgery isn't part of standard EPI treatment.
Right. Let's get into the specifics of medication. The main treatment is
Powdered pancreatic enzyme supplements. That's the drug of choice.
powdered, not pills.
Powdered is generally preferred. You mix a measured dose, usually based on body weight, like 1 teaspoon per 10 kilos, directly in each meal. It needs to be given with every meal at least twice a day.
Do you need to let it sit on the food for a while? Pre-incubation?
They used to be recommended, but current thinking is that pre-incubating doesn't really add much benefit. Just mix it in well right before feeding.
Okay. So enzymes first. Cobalamin injections second. Anything else?
For pets that don't respond as well as hoped just to enzymes and B12, sometimes adding a proton pump inhibitor like acoprazole to reduce stomach acid can help improve enzyme effectiveness.
Okay. And what if that gut bacteria imbalance, the dysbiosis, persists?
If the dysbiosis doesn't clear up with enzyme therapy alone, then a course of antibiotics like tylosin might be needed to help reset the gut flora.
You mentioned avoiding enzyme tablets or capsules.
Yeah, generally the powdered form is better because it mixes more thoroughly and consistently with the food in the stomach. Tablets and capsules can be a bit unpredictable in how they release the enzymes.
Now, you mentioned something really interesting earlier, using actual raw pancreas.
Yes, this is a fascinating alternative, especially for owners facing high costs or maybe pets who are picky about the powder. Raw pancreas beef, pork, or even from game animals can be used instead of the commercial powder.
How does that work? Is there a dosage equivalent?
There are general guidelines. Something like 1 to 3 ounces of finely chopped raw pancreas can often replace about a teaspoon of the standard enzyme powder. And the huge plus:
What's that?
you can freeze it. Raw pancreas stores well in the freezer for several months without losing its enzyme activity.
Yeah.
So owners could potentially buy it in bulk, chop it, freeze it in portions. It can be much more cost-effective for some.
That's a really practical tip. Okay, so treatment has started. How do you track progress?
Initially, frequent check-ins are good, maybe weekly for a bit. We're looking for the diarrhea to improve, ideally resolve, and for the pet to start gaining weight. That's the main goal.
And if they aren't improving after, say, 2 weeks?
If they're on enzymes, getting their cobalamin if needed, and still not doing well, that's when we might consider adding antibiotics for potential persistent dysbiosis. Once the pet is stable, eating well, good stools, healthy weight,
Then what?
then you can often start to slowly reduce the enzyme dose. The aim is to find the lowest dose that still effectively controls the symptoms. It often requires some trial and error.
Can EPI be prevented, especially in those breeds like German Shepherds?
Since PAA has that strong hereditary link, the main preventative strategy is really about responsible breeding. Avoiding breeding dogs that are known to be affected or have produced affected offspring is key.
What if things don't go smoothly? Are there common complications even with treatment?
Well, about 20% of dogs might not respond perfectly to the initial enzyme therapy and may need further investigation or adjustments. Persistent cobalamin deficiency, if not addressed, will hinder recovery. Occasionally, the enzyme powder itself can cause some mild mouth irritation or ulcers, which might mean adjusting the dose or how it's given.
But overall, what's the long-term picture, the prognosis?
For most pets, the underlying cause of EPI, whether PAA or damage from pancreatitis, is irreversible. So yes, it means lifelong therapy.
But with that therapy,
With consistent enzyme supplementation and managing any B12 issues, the prognosis for EPI itself is generally good. Most pets can live a normal, happy life. The outlook becomes a bit more guarded if they also have concurrent diabetes, as that adds another layer of complexity to manage.
okay, so wrapping this up, EPI is definitely serious, needs lifelong attention, but it is manageable for most dogs and cats. The key seems to be that enzyme replacement, addressing the very common B12 deficiency.
Exactly, and catching it early. Recognizing those signs, the weight loss, despite good appetite, the characteristic stools, especially if you have one of those predisposed breeds like a German Shepherd, early diagnosis makes a big difference.
So hopefully after this dive, you feel you've got a much clearer handle on EPI, what it is, who it affects, how it's diagnosed, and importantly, how it's treated.
You definitely should have the core concepts down now.
It really does underscore how vital understanding breed predispositions can be, which leads to a final thought for you to ponder. Given that hereditary link, particularly in German Shepherds, what are the ethical considerations around breeding? And maybe where should future research focus? Could we find ways to prevent that initial pancreatic damage in susceptible animals?
Definitely something to think about. How do we tackle these things proactively?
Interesting questions. Thanks for diving deep with us today.